Hi, hello. I'm Reinette Hampson. I work in London Northwest University Healthcare NHS Trust at Northwick Park Hospital. I'm here today with Professor Senior to tell you a little bit more about the contrast echo guidelines that were published today. We're very excited and feel very proud to be presenting this on behalf of the BSc. Professor Senior.
Hi, so I am a consultant cardiologist and director of echocardiography at the Royal Brompton Hospital and also at Northwick Park Hospital, London Northwest University Healthcare, where I'm also the director of cardiac research. And both Reinette and I work together in this particular hospital. So Reinette, yeah, go on.
So Prof, yes, we decided we're going to do a bit of a tag team, and we're going to tell you a little bit about these guidelines by answering a couple of questions that were posted to us. And we're going to start off by telling you briefly why these guidelines have been released. Now, back in 2012, under the leadership of Professor Senior, the BSc commissioned a national health survey to get an idea of the implementation of contrast in echo. The survey very surprisingly revealed that the use of contrast in routine echo in the UK was very limited to less than 4% of all transthoracic studies. Now, the major barriers to the implementation of contrast were found to be, firstly, the absence of cardiac imaging specialists directly supervising echo departments, and secondly, the training of echocardiographers to independently administer contrast. Now, we haven't done an awful lot in the 12 years or 11 years since the survey to address those barriers, but we're hoping that through this document, it will go some way in doing that. What do you think, Prof?
Yeah, so you're quite right, quite right. So we did do a survey in 2012, but also, Reinette, as you know, international guidelines are out since 2008, and then again a recent guideline came out in 2017 and 2018, both from a European group and from the American group, of which I was part of both, and but those guidelines are really about building a case or building lots of references of why contrast should be used. But I know we talked about it when we were about to start writing the guideline for BSc. We said, okay, we know that it is indicated, but this particular guideline is more about practical use of contrast echo. So another aspect of this, besides what you've mentioned, is to actually introduce the practice of contrast echo, whereby sonographers, doctors, they will know how to administer to get the highest quality images for diagnosis and also for prognosis. So this is other aspect of why this guideline has come about on behalf of British Society of Echo.
Yeah, Prof, and I also often tell people that, it's true what you say, both Sonavir and Lemenity was licensed back in 2001, and subsequently all the major international bodies have published, the ASC, the EACVI, ESC, and ICAS very recently. And the thing is, I think here in the UK, we perform contrast echocardiography under very different circumstances to our colleagues in Europe and in the US. We have a very unique workforce who perform echocardiographers. They include doctors, clinical scientists, physiologists, sonographers. Sometimes we have nurses and healthcare assistants involved in stress echo. And we also have a very unique human medicines regulation that legislate which healthcare professionals can prescribe and administer prescription-only medicine. Contrast echocardiography is a little bit different to normal echocardiography because we're introducing a prescription-only medicine. And then, these guidelines, you'll see that they break away from the traditional mold of a guideline somewhat. Like Prof said, we haven't gone down the conventional route of categorizing the evidence and making statements. We've summarized the evidence, the old and new evidence, and we've presented it in a way to serve as a practical guide. So it's very much a how-to document.
Correct.
And then, Prof, just briefly, you know, let's tell them a little bit about, you know, what we've covered within the guideline. As I've mentioned, the document provides guidance on the most current and the most contemporary practice in contrast echocardiography. There's some major safety updates that has implications for contraindications. And since ultrasound contrast was first approved in 2001, the clinical application of contrast in many centers have become routine practice. But hopefully with this document, we will help all members in how to apply the technique safely, effectively to achieve high quality diagnostic results where it's clinically indicated. Prof, I mean, shall I just briefly touch on all the topics? Just literally just name
Yeah,
the,
go ahead. Go
yeah.
ahead. Yeah, it's important to
Um,
do that. Yeah.
yeah, broad range of topics. So firstly, we start off by explaining all the different types of contrast available in the UK, the ones that we use. We talk about the medicines legislation for administration of contrast. There's a section on microbubble physics and contrast-specific imaging techniques. This is where the more practical stuff it becomes very helpful. And then the more clinical stuff, we talk about routine and non-routine clinical applications. No surprises there. We discuss imaging artifacts, again, a little bit more practical. And then we cover the clinical safety of contrast ultrasound. There's quite a few updates there. And then we also touch on the training and accreditation requirements and how to ultimately successfully implement the guidance into everyday practice. Prof, would you like to add anything?
No, I think you've more or less covered all the topics, but I think the only thing I would like to add is in this guideline, we have actually very strongly recommended the use of performing myocardial perfusion during stress echo. And as you know, the case has already been built for myocardial perfusion in stress echo because it has been shown in large studies, very large studies, multi-center studies, in meta-analysis, that it not only improves the diagnosis of, or rather detection of myocardial ischemia. So far, we've been detecting myocardial ischemia through wall motion abnormality. But we know there are certain, deficiencies by just relying on that. And the advancement is really to look at perfusion because it improves the detection of myocardial ischemia beyond wall motion and also improves risk stratification. So the data is already there. It's a question of really using it in daily clinical practice. And that's what we've emphasized in the guideline. In fact, there is a section on how to perform myocardial perfusion imaging, which is actually described in great detail. And therefore, whoever is about to start doing myocardial perfusion can go through that particular how to do contrast, how to do myocardial perfusion in the supplement. I think we have it in details within the document, which actually is a step-by-step guide and will be very useful.
So yeah, basically, I mean, myocardial perfusion could be a guideline on its own. It's a very comprehensive topic, and that brings me to one of the aspects they've asked us what we haven't covered in this document. Originally, we set out to include first generation contrast agitated saline, but we soon realized that the document would just be too big and not very user-friendly. So you can expect guidance on the use of agitated saline to be presented as a standalone document in the future.
Absolutely, yeah. And also in many documents, sometimes, we do put in, what is the future of contrast echo? In other words, what do we expect for it to evolve into? For example, therapeutics, you can use today, you can actually use contrast to perform thrombolysis before the patient gets, primary PCI. That not only dissolves the clot, but improves no reflow phenomena, which primary PCI has a problem with. When you do a primary PCI, the artery can be open, but the blood supply to the myocardium will still be affected. And using high mechanical index imaging, you can actually improve the blood supply. So there are certain other aspects that we could have included, but we left out because we thought we were going to concentrate on what is available today.
Thank you, Prof. And I think the very most important question here is, what do the new guidelines mean for practice? Now, as a result of the survey, it was very evident that the major obstacle in using contrast in routine everyday clinical practice is really the obstacle that echocardiographers have to independently administer contrast. And we hope that we will be providing members with the tools they need to set up services, where contrast is given routinely, where it's indicated, and also to help guide members into how to get good quality images to achieve, better diagnosis, to ultimately improve patient care. I think that's the ultimate goal of this document.
Yeah, so in the document, it's quite clearly stated that how you can go about having a service which is protocolized, and therefore, when a patient comes in and needs contrast, you already know how to go about doing it because you've got a protocol running in your lab. So that is very important, to have a protocol in the lab to administer contrast, and thereby knowing exactly who's going to do what. For example, in facilities where sonographers can't inject contrast. In fact, there are many facilities that you can't in UK today. You have to go through certain understanding with the nursing department. So you have got the PSD, etc., that you can utilize, but also you can set up a service whereby you have doctors around, where you have nurses around, that they will come. So the sonographer decides whether the contrast should be used. And if you've got availability of doctors, then the doctor can quickly come give the insert a cannula, inject the contrast. But most importantly, there has to be an understanding of protocol available to run the service properly.
I think now that we've established these guidelines, I think that the BSc will make available education tools through the e-learning platform in future, to facilitate some of the training requirements set out here. As far as accreditation is concerned, there's nothing official. It's all basically competency assessment in-house in your own department. It's part of your own governance process. You will need to assess your members for competency, but hopefully going forward, we'll be rolling out some educational tools for people to assess, to accompany this guideline.
Yeah, no, absolutely. I think that's very important. Now that the guideline is out, now it should be implemented, and this is a very good way of implementing the guidelines. In all hospitals that have that are using contrast.
And ultimately, I think this document really came about because members were reaching out to the BSc, and then, ultimately the BSc passes these queries on to Professor Senior and myself, and we got to a point where we realized there was really a need for guidance on the topic. Many people, maybe wanting to start their own service, or maybe wanting to embark on more advanced techniques like myocardial perfusion. And we just hope that this will help promote the technique, and please continue to reach out to us. And from my part, I just say, I wish everyone luck with all their future endeavors, and please reach out to us anytime you need any help or advice.
So absolutely right, Reinette. So this is a great opportunity for all those who are using contrast to actually now they have a document. Now they have actually protocols are also written there. You can follow. You can just get the protocol out of that document and use it. So it's very user friendly. And as Reinette has said, if there's any difficulty, you can reach out to us, me and Reinette, and we'll help you get this going. Thank you.
Thank you very much.
Reinette.
Thanks, Prof. Thank you.